Definitely the interaction with the patient. Definitely the improvement that it brings in somebody's life. Anywhere from obviously an acute infection and swelling, the instant relief is satisfactory. However, the long term benefit of somebody maybe towards the end of their life who has a broken down dentition or a faulty denture that finds the simple enjoyments of life of eating and chewing to be an excruciating pain event in another one is trying to enjoy a pleasant meal or their favorite meal. To be able to reestablish that love of food again and be able to chew and enjoy it without being worried about they're going to bleed as a result, they're going to hurt in the process is quite a marked improvement in their quality of life, and that's very satisfying.